Hi everyone. I just came back from the hospital. I had 3 doctor's appointments today. I'm about 9 months post-op approximately right now. I had my Lupron. Actually, I'm going to show you the, I had my Lupron. Yeah, this is where they put it. It's funny because usually I feel like it's lower down. I thought she did it pretty high today, but I took a picture when I went there to the infusion center. I took a picture because I'm like, I just want a picture what the shot looks like. And it's like a pretty long shot. Haha, long shot. But she covered up a lot of it with her hand, and I'm like, no, I want to get like the full picture. Maybe there's like, I don't know, rules against it. But anyway, there's my Lupron, and here's my bra sticking out because that's just how wardrobe is. So that's what it looks like. It feels like a flu shot, in that like it goes into your muscle, and it just takes time for it to, you know, just gotta move your arm around, and then I'm usually fine. And I don't mind the Lupron so much because it makes me stop crying all the time. But I had, I'm not going to go through, I'd be here forever. I mean, I literally left at like 7:30 this morning, and it's 1:30, and I just got home, and I've been at the hospital all this time. So, why, you ask? Or if you don't ask, whatever. So I went for my Lupron. I also had an appointment with the oncology nurse, because of all the complaints that I had. And I find today's vlog, like I'm going to title it being sort of like a year post-op, meaning seeing my breast surgeon again, because that's, I think, the biggest thing I really want to focus on. But I want to give you some couple of just update tidbits for those of you that have been following along all this time with this whole process, and you know where I am with stuff. And I'm not going to go into super detail because there's just a lot, and that would take 6 hours of a vlog. So I brought up several things that have been going on that I think I had told you. My oncologist had said to me that, you know, I said, this is wrong, and this hurts, and this is what's going on, and this is what's achy, and why do I have a cyst on my hand? Like, what the hell is going on? And I said to her, this is all through messaging. I said to her, like, I'm just sad, and I'm crying a lot. And I meant, like, I'm crying a lot because there's just so much shit going on. There's so many parts, and they're like, you don't even know who to frick to blame. There's so many damn cooks in the kitchen. Like, I don't know. And it's frustrating. And physically, I had asked to have an appointment with my breast surgeon because I haven't seen her since the day after surgery. And I was a tad sedated still at the time, so it's not like I remember a damn thing she said. She came in to check in on me, and I haven't seen her since. And I'm like, all this time has gone by, you know, my breasts, my implant. Wow, I called them my breasts. Yay! Wow. Oh my God, milestone. I called them my breasts. That's kind of a big deal. I have not called them my breasts. I usually call them the foobs. Huh? Acceptance. That was weird. Lots of moments today. I'm drinking a beer at the same time. I don't usually drink in the middle of the day, but after today, I'm like, holy crap, I need a beer. So cheers. Cheers to all you survivors out there. Because on a hot day, sometimes you just need a cool one. Anyway, yeah, that was big. I forgot what I was saying. I've been healing, you know, very, very slowly, but still, you know, 2 steps forward, 1 step back. And I had a lot of questions about things that don't necessarily have to do with physical therapy or with the implants, aka what's now in my boobs. And I didn't understand the stuff about the lymph nodes. And like, you know, when I went for my Lupron, they're like, which arm do you want it in? And I said, I think my left, because I'm told I'm not supposed to have stuff done to my right side, because I had most of my lymph nodes taken out. Not most of them. I found out today there's 30 lymph nodes, I guess on this side, I think. There's 30 lymph nodes. I had 6 removed. So I thought 6 was a small number but when she said it's at a 30, I'm like, that's what, 1/5, 20% of my lymph nodes were removed. Like, that's some pretty big shit. So I'll get to that because I want to focus on the breast surgeon appointment today. But yeah, so I had all these complaints about things, and I was told, like, after I said I was sad and crying, the immediate thing is, well, like, why don't you try meds for, like, you know, for depression and stuff. And I'm like, I'm not depressed. And I know I've talked about this before, so I'm not going to get too far into it, but I got really mad. I got defensive because I'm like, I don't want another pill to cover up the side effects I'm having, because there's like a layering of what's going on. Like, here's a breast cancer, okay, it's out. Then you have the surgery, then you have the meds, then you have the other meds, then you have the meds to combat the side effects of the other meds. And it's just, okay, let's add an antidepressant on top of that just to mask. I want to go back down to here, like, what's happening with my body and why, and what can I do to fix it? I'm not a big, I respect, you know, clearly, because I'm on them, I respect the power of medicine. I also respect that there are things that you can do outside of that to change things. You know, I watch my blood pressure mostly through diet, exercise, meditating, all that stuff, gratitude, painting rocks, you know, whatever. I know that there are other ways of handling things. And if you get to a point where you've gone through your bag of tricks and there is something else that works and you need help, then yes, I totally understand that. But to go from like 0 to 100, that like, let's just not talk about all these side effects you're having, let's just plop them in on top of that, I'm like, no. So I kind of lost my shit. I did apologize after, because I thought that my messages came across a little disrespectful, but like the old, like immediate post-op Jen would have been like, no, this is just what it is. You know, I stood up for myself a lot more. Now I'm kind of reverting back to like, you know, watching how I talk around people, and I want to go back to that. I don't like being like that. I don't want to go back to that. I want to like keep advocating for myself and not letting someone else poo-poo what is going on with me. Oh my God, it's hot. Today's the first day it's like 70 degrees outside and I was sweating my ass off. But yet I'm again back in a place where I'm not comfortable, like, because, you know, here's my bra sticking out, and I don't want to, I'd rather suffer right now in my heat. Anyway, so I talked to the nurse about all these things that were going on. That's why I scheduled this appointment. I was going in for the Lupron anyway. My blood pressure was pretty normal, which was very nicely surprising, because it's been pretty high the last couple of times I've gone in for stuff. But I wanted to talk to the nurse and kind of, you know, tell her what I mentioned in my vlogs to you and what I had said to my oncologist. And I'm like, you know, I am my biggest advocate. If I were my own child, I would not let them just, you know, add something else onto the pile versus trying to understand, why is the pile there? What else can we do? So I had a really good talk with her. Unfortunately, it was only a half an hour. What was nice was that she said, you know, well, what are you doing tomorrow? She's like, do you want to continue the conversation tomorrow so she can give me the time that I asked for, which is huge. And I'm like, yes. I'm like, I just want to be heard. I just want to be understood. And I just want to get some answers. I don't need the nitty gritty of like every minute detail. Like, not that I don't care, but I probably won't understand the science behind it. But I want to know enough in layman's terms to understand what the hell is happening to my body. And like, what can I do? And I totally got that today. And what I didn't get in that half an hour, I'll get tomorrow, because she gave me another appointment tomorrow for half an hour to continue talking about it. Thing that was put on the table that, sorry, I'm really hot. Like, I shouldn't care. I'm gonna take this off. I shouldn't care. Like, I wish I can go back to not caring as much, but I care again. Like, I'm nervous around people again, and I don't like that. I need to, not enough to care to come on and have like no makeup on and have my hair back in a bun, but anyway, so the conversation came up again about all this stuff, and my understanding, oh look, my thingy's still on my wrist too. My understanding is that like it's all med-based. It's all med-based. And she said, you know, which I loved hearing, she's like, you are a perfectly normal human being, and then kabam, you know, you go into surgery that obviously takes a lot of healing, and then you have all these meds thrown at you that takes your body and pushes it into menopause, which it wasn't ready for. Someone saw me today and made a comment that I was young and I had my mask on, someone that I don't like really know. And she's like, oh, you're so young. And I said, you know, okay. I'm like, I'm 50. She's like, you're 50? So it's great that people think I'm so young, you know, and my body says, says that, yeah, I'm 50 and things are starting to happen. But she's like, you know, you were this perfectly normal person. And then like, boom, cancer comes around. You have your surgery. We give you these meds. It throws your body into menopause, which it was not ready for. You know, all so that you don't have the cancer come back. Like, it's like boom, boom, boom to your body. And like, your body's just like, you know what? Enough. I've had enough, you know? And I think it's just giving me these other signs, like, I've had enough. Like the cyst on my hand, I don't know if you can see that right there. I have this like bump right here. It's actually kind of coming through onto the other side. But I'm a righty, so it becomes a problem. And from my understanding, like it could just go away by itself. I'm just gonna like keep an eye on it. But obviously can't go back to playing tennis right now because I can't even to use a mouse, like hurts. And then like my heel's bothering me, and that could be because of the meds. It could be all these other things that are going on. But it bothers me to the point where, okay, here's my fashion faux pas. I wore like, the jeans I have on are like form-fitting. It's not like they're flared at the bottom or something. And then I have sneakers. I don't like the look of like normal like size jeans that are like tied around your ankle and then bulky sneakers. I think it makes me look like I'm an old school marm. Not that my hair in a bun doesn't do that, but that part I don't care about. It's a matter of like comfort, and I feel like my body is doing these things to rebel. I started getting a pimple in the exact same spot, maybe like a hair of a centimeter down than my last pimple. I hardly ever get pimples, and it's like my body is just telling me I've had enough, like something needs to change. Even the crying and stuff, you know, like yes, it's hormonal. Yes, it goes away usually like 2 days after I have the Lupron. But my body is telling me things. And if there's one life lesson I've learned from this whole cancer shit, it's that, you know, you need to be aware of all these things and not poo-poo them, because you need to listen to your body. It can't orally speak. Well, I mean, yes, but you know what I mean? Like, the parts can't speak and tell you, like, what's going on. But you have to respect these little things that pop up before they become bigger things. And for me, the becoming bigger things is, I'm not happy with my quality of life right now. I'm not. And I used to be a glass half full person. And, you know, it's getting warmer outside. And I got a thing, oh, do you want to have your season pass for kayaking again? I'm like, yeah, but I can't lift my body weight with my freaking arms. Like, I can barely put my hair back in a decent looking ponytail. I can't do that. I know there's ways around that. But the point is, I'm not happy with my quality of life right now. The sadness and where I am right now is not who I want to be, and I've had enough with trying to cover it up with other things to make it feel better. I mean, here I am having a beer, but I hardly ever have alcohol. Yeah. So where the conversation went, and then I'll switch over to the breast surgeon. Where the conversation went was, my gynecologist had said a few vlogs ago when I talked about when I had my uterine surgery, you know, then the next time something happens, because most likely there will be next time something happens with my uterus, she's like, I think it's time we consider removing it. So that came up again today, that like, you know, you have your kids, you know, am I gonna have more kids? No. Do I physically need my uterus for anything? No. All it is causing more issue right now. Why do I have it? Because I didn't want another surgery? I mean, sure, try all these like less invasive things first, which I've done now for whatever, nine months in surgery, you know, or probably 8 because I wasn't on meds right away. But I've tried all these things, and I don't like what it's turned my life into. I don't like what it's turned me into. In the beginning, I feel like I was even more empowered than I am now. And this is part of the cycle, or not cycle, it's part of the journey of being a cancer survivor and breast cancer survivor. That, you know, you're like in DEFCON 4 when things first start and you're on the priority list. If you call the doctor, it's like, oh, we'll call her back right away. And then you get to a place where I am now, where you're 9 months out, nothing severe is going on. It's not like I'm like dying, you know? So it's like, you know, you're not on the top tier like you used to be. And yet, like, I'm not happy. I'm not happy. And I'm grasping at straws for things that brought me happiness, and they're not anymore. There's a thing about being numb, but I don't want to be numb anymore. I don't want to not care. Maybe that's part two. Like, I don't want to not care anymore, and a change needs to be made. So, you know, she said, like, if I have my uterus removed, I don't need the Lupron anymore, because obviously having your uterus out, well, there's menopause right there, you know, like nothing would be happening. But the whole point with the post-cancer stuff is to have no estrogen in my system. And that comes from my ovaries. So it wouldn't just be my uterus, it would be my ovaries too. And I imagine my fallopian tubes, because why would I need those just floating around? I don't know. And I wasn't like originally thinking of some big surgery or whatever. And I know they can do things laparoscopically, you know. So maybe even right now, I don't know, after I met with the oncology nurse, she said she was going to meet with my oncologist and my gynecologist and just come together and talk. Like, is it time to just be like, you know what, let's get rid of the organs and give her life back somewhat. My understanding is that, like, I would be off the tamoxifen, because tamoxifen is, you know, if you're premenopausal, and if I'm not producing estrogen because I have no ovaries, there's no reason to be on the tamoxifen anymore. But I would then move to an aromatase inhibitor, because I clearly would be past menopause because I don't have those parts anymore. And my understanding is that again, not a doctor, disclaimer, the aromatase inhibitors have less side effects than the tamoxifen does. And I wouldn't need to be in a Lupron then either. And I wonder if I would even need the Zometa at that point too. Which I'm scheduled for in 2 months. So I don't know. We'll see. No decisions made yet, but that's just on the table. So there's that. And then I had a pause. Like, I went over to see if I can get in to see the breast surgeon earlier, but I couldn't. So there was like a 2-hour span, or not 2 hours, like an hour or ish, an hour and a half of time where I had nothing to do. I couldn't get into, not enough time to go home and come back. Gas prices are too expensive right now anyway. I didn't even have a book on me. Like, I wanted to get some food. But I went walking around the hospital, and I can't even say they were necessarily triggers. It was more observatory, that I was walking around the hospital, and like, I go in the West End. The East End is where you go for surgery. So I started walking. I was going to go to the cafeteria just to get something to eat. And then on my way, getting lost to get there, I passed by all the like restricted area, do not enter, surgical, blah, blah, blah. And I'm like, oh, like, I wonder if that's where I was, you know, from an outsider perspective. I had no idea where I was in the hospital. I don't know. I just saw like me rolling in and me rolling out. Like, I really don't know where, like what was going on. But you pass by all of that, and even seeing like the hospital beds in the hallways that are empty, it just all came back. Like, I don't think I've walked through this part of the hospital since I had my surgery. And it all comes kind of wafting at you, not in an overwhelming way. It's not like a teary way, just like an observant way. And then I finally found a cafeteria. I got something to eat and still had time left over. So I went to the prayer room just to pray for some guidance for right now. I feel like those rooms are underutilized. Usually, like, you know, people go to them when something severe is happening. And I just felt like I needed to be in there just to connect and have some quiet time and just, I don't know, just be. And then I went back down to the breast center. And the breast center has, it's a double door, and the windows are frosted, so you can't see inside. So I don't get triggered walking by it because the windows are frosted, like whatever. But I opened the door and it was like, poof. Like the last time I was in this room was when I was finishing my my like 8-hour day. Today was like a 6-hour day. My 8-hour day of my, mammogram biopsies and ultrasound biopsies, and finding out that was when they said, you're not going to die from this. And I knew I had cancer then, although it was like, you know, official when I got the phone call at home. And then when I met with the breast surgeon after to talk about like what they were going to do about it. But being in that room in the breast center, like I walk in and the imaging is straight ahead of you. The place I needed to go to was like to the right. But I walk in and there's probably, I don't know, 25 chairs in there. And I sat in the waiting room, and it's still the same room, just over a little bit more, that it's like designated for that little breast center area that I was going to. And you know, you look at these women, and there's so many women that come in, and it's just so like, what's your name? So-and-so. I'm here for my 11 o'clock appointment. You know, here's your wristband. And it's just so normal. And statistically, I've said it before, like one of these women is going to get really shitty news when they leave. Unfortunately, that's what the numbers are right now. And it makes me proud also that I was one of those women. And I learned today I will not need to ever have a mammogram again, because there's nothing to have a mammogram of. Of silicone. Like, I don't need them anymore. Yeah, I don't need them, don't need ultrasounds and stuff. I mean, unless maybe something was wrong, I don't know. But all those images, like, don't need those anymore because I have no breast tissue left. Which is kind of funny, going into a breast center, and I'm like, why am I in a breast center? I have no breasts. Why is that funny? I don't know, that was an awkward laugh. It's like, I'm at a breast center without breasts. But then, like, rewind, like, whatever, 20 minutes ago, I called them my breasts. All these, you know, stages of healing. Anyway, so, yeah, I'm just watching all these women coming in and being called back. You know, they're very nice there, but it is like herding cattle, which is like one after the next, put the Johnny on, blah, blah, blah. It's an interesting experience. I mean, if you're female, you've gone through it before. And if you're a male, ask a female, you know. There was one guy there that was there with, I assumed it was his wife, and he was holding her purse. And he thought he could go back with her, and I guess maybe because of COVID and stuff, our rates are going up again. He couldn't go back with her, and he's just kind of standing there like that, knowing what to do with himself. And he's like, he said to the woman behind the receptionist, he's like, "Can you hold her purse, because I need to use the restroom?" And I'm thinking, dude, there's hooks. I would think that there's hooks in a men's bathroom. Well, I have been in one before, but I don't remember. Yeah, did they not have hooks in the stalls? Like, you just put it on the hook, you know, whatever. But it was funny that, like, he didn't even know what to do with her purse. And, you know, he goes and sits in the corner away from all the other women. And, you know, you just go in just thinking things are fine. And for someone, it's not going to be fine. And again, coming back to me, it's like being on the other side of that, looking at the sign that says breast center on it, and then I'm like, I don't have breasts anymore. I'm in the breast center. Like, that's just weird. That was the biggest thing to reflect upon, honestly, that just kind of weirded me out. And then, so to add that, I've only actually been in that room, or in that section of the breast center. This would have been my third time. The first time was when I had my initial meeting with someone about having a baseline MRI done. The second time was with my breast surgeon after I found out that I had malignant tumors, and I had a 2.5-hour appointment with her going through like, okay, here's what's gonna happen next. And then today. So I go in and there's plenty of rooms to choose from. Of course, I only go in that one room. All 3 times I've been in that one room. And I put my stuff on the chair, and there's 2 chairs. I'm like, oh, last time I was here, it was me on this chair and my friend on the other chair, and I haven't talked to her and I don't even know how long. I don't know what that's about. And I remember, like, I'm like, oh, there's the computer that I was looking at all the images, and I was there for like an hour before I started tuning out. I mean, I imagine, I can't remember even when I started the vlogs as to what date. Maybe it was that date. Maybe it was July 9th. I don't remember. I have to go back and watch the first vlog or 2. I honestly don't remember what made my day 1. I feel like it would have been that appointment. I don't know. Whatever. I'll have to rewatch at some point. But yeah, there's the same 2 chairs. I put my stuff down. I look up, I'm like, oh, the wall's blue. How funny. Is that like an internal joke? Like, I don't get that. It's not the same like royalish navy blue that are in that's like the plastic surgery color wall with all your pictures, but it's still blue. And I'm like, why are they, and only that one wall is blue. The rest are like cream colored. I'm like, what's with the friggin' blue? I don't know. And she's like, here, you know, put the Johnny on, whatever. I mean, she didn't say it like that, but put the Johnny on. And I was fine because I wanted her to look. I didn't want to have this as a Zoom. I'm like, I want to have her see what they look like. And the whole point was to understand like what is happening around here. I might even show you some of that today. All the other parts that aren't my actual implants, I'm like, I need to understand what the hell's going on. I don't get it. Why do my hurts hurt? Why does it look like this? Whatever. So that's what I want to share, which I think is really important for anyone that's like earlier in the process than where I am now, who's trying to understand like why their body looks the way that it looks. So she comes in and, I don't know, the second she even said hello, it like immediately brought me back to her saying hello when she walked into my hospital room the day after surgery. And she pulled back the curtain and I saw her face. And she just put her arms out to give me a hug. And I hugged her. I hugged her. And I just didn't want to let go. And I'm like, thank you. Because she saved my life. And you know, there's like good huggers and not good huggers. Like you can hug someone who's like I'm tall. Like I can hug someone who's much shorter than I am, and it's kind of awkward because I'm like keeling over, whatever. But I was sitting down on the table thing, whatever. I wasn't in one of those black chairs, and she was just such a good hugger. And I didn't even know what to say. Like, what do you say to someone who gives you your life back? You know? So I hugged her, and it was honestly like the best hug I've had in a really long time. With COVID, like I missed that. I'm a huggy kind of person. And it's one thing when like you lose a lot of like friends and stuff throughout this whole process. But touch is like important to me, and just like the hug. And to rewind for a sec, when I saw the oncology nurse, she gave me a hug too. She's thin, so for some reason like it wasn't like, I kind of wanted like a bear hug. And she's thin, and it was Like, I'll never say no to a hug. Well, mostly I won't say no to a hug. But when the oncology nurse hugged me, she also said, I think, or at least what I heard, she's like, it's all gonna be okay. And I said to her, you know what? After all the complaining that I did, that's all I wanted. Like, yes, I want to understand, but I want someone who knows what they're talking about to just give me a hug and tell me it's gonna be okay. So just for that, like, you know, even though I was there for 6 hours, that hug to tell me it was gonna be okay, just like flipped the switch for me. And then hugging my breast surgeon, it's almost like getting a hug from my best friend. And like, I don't remember what she said. It was just a really nice hug. She hugged me at some other point, I think before she left or something too, I don't remember. And she commented on my nails, like what cool color I have my nails. But taking in that room, like, I'm looking at the sink, I'm looking at the drawers, I'm looking at all, like, every little minute detail in that room. And it just, like last time I was in here, I had cancer, and now I don't. And I don't think, so like when you have a mastectomy, I never pronounced the other T, mastectomy. You have follow-up appointments yearly with your breast surgeon. I didn't know that. I guess I missed that memo. So I'm only 9 months out, but this counted as my like 1 year post-op because I don't need to see her again. Unless something pops up, but there's no reason to see her. So my next 1 year is in May of next year, which actually I think is good because I'm like, well, you know, normally I'm very, I'm like, shouldn't it be in August because my surgery was in August and everything happens in August. And I have a lot of shit that happens in August that's not good shit. And I'm like, you know what? Let it be in May. I think it's important that it's in May and not in August because I don't really like August. I don't really like mid-August. I don't. There's other reasons why I don't like mid-August. I'm like, May is different. May is spring. May is flowers. May is new beginnings. I think having a yearly appointment in May is a good thing. And not having August be like, bah. So I explained, like, the vlogs to her in 30 minutes or less. So things I learned. Very important thing that I learned. Like when I had my Lupron this morning, you know, what arm do you want it in? Do you have lymph nodes removed? Oh, you know, again, I put a large disclaimer here that I'm not a medical doctor. I'm relaying information that I've heard. So just, you know, just putting that out there. Seek advice from your own doctor because everybody's different. When you do blood pressure, they're like, oh, which arm do you want? Because, you know, I had lymph nodes removed from both sides. So, old school thinking from what I learned today is that if you've had lymph node work done, you should not do blood work, anything that requires a needle basically in your arm, things going in or out, blood pressure, any trauma basically, you should not do to the side that had the lymph node work. But I found out today that that's more old school thinking and how people were trained when they went to school X number of years ago, and that reasoning is not there anymore, at least not for me. Like I said, I'm not speaking for everyone. I learned that there are 30 lymph nodes. I'm sure if you've had all 30 removed, it's a whole different story. I had 6 removed here and I had 2 removed here. I still, for whatever reason, can't not think that that's 20% on my right side because it seems like so much more than I thought. But explains to me why I have so much more issue. Like I knew I had more lymph nodes taken out. I should have more issue on that side. I feel like I should take off my wristband because I want to show you stuff. And I don't really want you seeing all my personal information on there. Hold on a second. because I'll lift my arms up and then you'll know all my identifying information and like, no thanks. Boundaries. Okay, it's off. And I'd actually like to throw these out because, well, you know what? I'll do that later. I won't forget. I don't like to keep them out in front of my son. Like, he doesn't need to see that shit. All right, anyway. So, yeah, so I asked her about that, and I said to her, you know, I am planning on having a tattoo done probably in the fall, late summer or the fall, on my left wrist, so it's not my right wrist. And she's like, it's fine. Like, you know, I don't have to be careful of whatever. Like, it's okay. I assumed that if I wanted one on my right wrist, I could have that done, but I didn't even ask her that, and that's not what I want. I purposely want on my left wrist, even before all the surgery and stuff. But she said, like, when it comes to like blood pressure, like I have FMD and fibromuscular dysplasia, underdiagnosed. It's not necessarily rare, it's underdiagnosed. And the gist of that is I have to keep my blood pressure under control because it increases your risk for stroke. So I take my blood pressure pretty regularly just to check things out, especially lately because it's been kind of high. And one of the, I mean, yes, there's the common things you look for stroke, like, you know, your face is sagging and your speech and, you know, all the signs of stroke. But another thing you could do, like if your blood pressure is one thing in one arm and it's off by like 10 or 20 in your other arm, like that's kind of a red flag because your blood pressure should be the same or similar in both arms. So when my blood pressure is high in one arm and I get kind of concerned, I used to always take it in my other arm just to see, well, where's that one at, you know? And then if it was off by a big number, I just like hold off and take it again a little bit later. And I mean, I've never, as far as I know, have ever had a stroke. So she said, no, like, she's like, when you had surgery, she's like, you had a blood pressure cuff on your arm. Like they were taking your blood pressure while we were actually doing all this stuff, just to make sure that you were, you know, okay. I remember them having a thing on me and on my legs too, actually. Something about blood flow, whatever. So that was interesting to learn. And again, not for everyone. I don't want you to go out there and be like, oh, well, I learned on the vlog that blah, blah. No. You go ask your doctor because every person's different. But she did say that was old school thinking. So it was relieving to hear that like I could do these things and not have to be so overly concerned. If they couldn't find a vein in my left hand and my left arm, they could use my right arm if they need to. So yay. What else did I learn? So parts of what's going on. The sweating and the smelly, you know, my smelly armpit I talked about for so long. And I assumed that was a lymph node thing, and it turns out that it's not. She said, if anything, she's like, you know, the sweat comes from hair follicles. It was interesting bringing up the hair part because she's like, you know, if you have a lot of hair under there, I guess the sweat from the hair follicles would make it smell more. And I said, if anything, since I started the tamoxifen, my hair has actually been thinning. Like, it's not as bad now. It's kind of come back a bit, but my eyebrows were getting thin. I think I talked at one point about having to fill in my eyebrows because, like, they were getting thin. But I noticed, like, I don't shave my legs as much anymore. And, like, even my armpits, I don't really have... I'm not a hairy person in general anyway, but I don't really have a lot of hair under my armpits. So I'm like, if I don't have a lot of hair and it's still smelling, I don't really get what that's about. But it's not a lymph node thing. That's not what sweat or any of that stuff is about. She said like the sweat and all that is more of a like a surface kind of thing where it's closer to your skin, like the outer part of your skin. Whereas like she's like the lymph nodes she's like they're in there. It's not like they're on the ends or something. Like they're pretty deep into your body. So they're not related at all. So I don't know what that's about, but I'm grateful that I don't stink as much as even as much. Like I'm just like normal now, but I do sweat a lot more. And in general, again, that's probably because of meds and menopause and all that like non-fun stuff. So she had me move my arms around. She did take pictures. I wasn't up against a blue wall. She just took pictures. I would have been interested to ask to look at my befores and afters, but I'll ask that next year. I don't know. I don't think I'm ready to actually look at that. I have pictures on my own phone because like when I came home from surgery, I had to take pictures or Barb how to take pictures and then send them to the nurse to see how I was healing. Oh, and that's something I want to bring up too. I don't want to forget these two things, which are helpful. God, I lose my train of thought way too quickly. The lymph nodes are deep. Whatever. Anyhow, I'll loop back through it. So she had me moving like around. Oh shit, the pictures. She had me moving my arms and stuff around. You know, she knew about the frozen shoulder. She looked at stuff. Basically said that I'm gonna be in PT for a while. She's like, she very much like is thrilled that I'm doing the myofascial work. She's like, it hurts. Cause like they're basically like, you know, pinching your skin to get everything up, not pinching, but like, I mean, really they're just doing like this to get everything back and moving again. She also asked me about, she's like, how is it down here? And I'm like, it's funny that you bring that up because I'm doing more work with my arms than I have in years. And I'm like, you would think because I do tricep work that this wouldn't look like this, but it is, you know, and weight loss is not someplace where I am right now. Toning is not someplace where I am right now, not out of choice, out of direction. Like I should not be working on strength training right now. I have to work on healing and regaining feeling. Like I should not be skipping that step because I'll actually be doing more harm than good. So these guys will need to be here for a little bit, but I can feel them. So an interesting thing that she was doing, which I would think is common for a year out, is like just, you know, even like here, she's starting at certain points and she's like, you know, do you feel this? Do you feel this? Do you feel this? And just noting where I have feeling and where I don't. So that was interesting. She said something too about, well, I guess I'll get into about these. These are silicone strips. Well, it's kind of cut off, so I'm not actually sure. Silicone tape, yeah, it's silicone tape. You can get it through Amazon, it's $12.99. But I said to her, like, she asked me what kind of bra I'm wearing. So like today I have this on, which is my True & Co bra. It's one of the V-neck ones. Actually, look, there's my pretty cleavage, whatever. Well, see, look at that. I just gave myself I gave myself 2 compliments in one vlog. How nice is that? So yeah, so there's my True & Co. But see, like there's a pimple. Like what the fuck? I don't get pimples. Yes, I do now. Anyway, so she was like, I showed her this bra, which is great, but like it doesn't provide a tremendous amount of support because it's so like super stretchy and stuff. The tighter ones bother me because it still hurts under here. And I don't know if I told you, but the plastic surgeon gave me the name of, there's a person who's in New Hampshire, which isn't that far from me. It sounds like another state, but it's like 15 minutes. Who purposely fits women for bras post-mastectomy. So I will be calling her to get more of a supportive bra because yes, I can walk around without one, but what I mentioned to her was that like I was looking at old pictures of my scars and they used to be pretty thin lines. They were really dark, but they were thin lines. And I'm like, and now they look like almost like they're like pulled a little. They're lighter in color, like they're pink, but they're like pulled a little. And I'm like, I don't want them, is it becoming that way because my skin is just, it's too much and it's pulling it down. I don't want to have bigger scars because I'm not wearing a bra. So that's when she sent me this, or gave me this paper about the silicone tape, which is tape that you put across your bra, or across your scars, and you just let it stay there until it gets, I don't know, I guess gross. And then like it's numb there, so I won't feel it anyway. But apparently the tape helps in minimizing the appearance of the scar, which yes, please. So I'm gonna try that and see how it goes. She said like, you could do it for like 6 months or something, or, whatever works. But I'm not ready. We talked about nipple reconstruction and stuff. And I said, I'm not ready for that yet. And if anything, I want my scars to be lighter before I tattoo anything on top of them. So that should help. So that was a cool thing to learn. Another thing too, but that was a cool thing to learn. So yeah, so she went poking around and then like I showed her like, she wanted to compare me lifting and she could see like, my left, well, right now my left arm's sore because of the Lupron, but when I lift my right arm up, like my whole boob area goes with it. and it's not as like free flowing as this side is. So what my question was to her was like, you forget what your body looked like before. Like, it's so quick between diagnosis and surgery, at least for me, that like I didn't really have time to like look at my body enough to know like, what did it look like before? You know, like I lift my arm and like I have this little indentation thing there, and I'm like, did I always have that? Is that for the lymph node stuff? I don't know what that's for. If I go down to here, which I don't mind showing it there, but like when you get down to this section, I have like excess skin here, which apparently is just like, I don't know, it's just my body, but also the way scar tissue has formed, not my friend, scar tissue, I mean. Like around this area, it's like I have like a little like this side is all like nice and smooth up and down, and this side has like a little bubble, which not bubble, but like a little just excess skin, which I can go in surgically and have it fixed. Do I want to? I don't really think I do. I don't need to be like a Barbie doll. Like my old boobs were probably like that. I don't know, but I don't really care so much. What I was curious about was like part of that extra skin, I have almost like an indentation. So just in like one spot, it just like goes in and then it comes back out. So I assumed that was where she had moved or removed one of the lymph nodes, and it's not. She's like, it's way deeper than that. She said what that is scar tissue, just like pulling and like pulling the skin towards it, but it's all scar tissue. So from what I'm gathering is that like I just have a lot of scar tissue that's growing. And yeah, I have it, you know, obviously this is all my pectoral muscle and stuff, and you know, she's doing the myofascial work, and she said if anything, she's like, she would have my physical therapist expand where she's doing the myofascial work to also include this whole area on my side, because it is all impacted. And like I do have feeling in certain spots, and certain spots I don't, and there's still some swelling, but yeah, like that, she was just poking around like, what do you feel, what do you not feel? My ribs were an interesting thing in physical therapy, that she was pressing on like underneath my boobs by my ribs, and it really hurt. And that's a byproduct of the implant, because they're heavier. Like I think like implants are just heavier than regular boobs are. So they push against the ribs, and it makes sense that they're going to be sore, and it just takes time for your body to just, you know, to just get used to it, or, you know, wear a bra that's going to push them up and like bring them back in, to take the weight off of your ribs. So again, I guess you know, oh, you don't have to wear a bra anymore, yay for you, you know, maybe you kind of still need to, not all the time. I mean, I can get away with not wearing it, you know, out in public, but like I don't think it's going to be an all the time kind of thing, at least not for my body. So yeah, and I said like, you know, about my maneuvering, I'm like, you know, she's like, they all encourage you to touch as much as you can, to bring back the feeling, to have some ownership that like, yes, these are yours. And I know I'm like super close up, but whatever. Like, yes, these are yours, and you can touch them and you can move them, and like, you're not going to hurt something, you're not going to break something. I told her like I was wearing a camisole, like a workout camisole that had a shelf bra built in, and it was kind of like tight. Well, you could see here, I'll back up all that. It was kind of tight, like over here, and you could see, like, this is how you know someone's had an implant. Like, you see that big difference right there, you know, like boom, there's the implant. I don't care if someone knows I've had implants. I'll be more than happy to share the story. Clearly I'm a talker. But I said like the shelf bra was like the seam was right here. And I'm like, I don't want to make this change here worse. So like, is it bad that I do that? And she's like, no. This can be fixed, by the way, with fat injections. I know that I'm not ready for that at all. Like, yeah, let people think I have implants, whatever. That's probably the lowest I've gone with you people before, but yeah. Like, it's funny because like here I have feeling, here a little. If I go down there, nope, nothing. So yeah, there's probably other things I'm not thinking of, but I'm almost at 15 minutes already. So it was really educational, and I didn't want to. There were so many parts of today. I didn't want to like not mention something that was important. So I'll see her in a year. I also asked her about like extra supports now that I'm ready. And they do Reiki there for post-mastectomy patients or women, whatever, men. The first one I think she said is free, and then it's like a discounted rate or whatever. And I'm like, please, I love that. So she's gonna put the referral in, get me set up with that, which is awesome. Whether or not Reiki works, I don't know, but it certainly doesn't like hurt. So, you know, bring it on. Last thing is there's a peer mentoring group. Now I know a lot of women in this town who have gone through breast cancer. Some have shared pictures of their pre and post surgery breasts with me. Some don't want to talk about it at all. You know, it's interesting, you know, how people are with it. There's one person in particular who has just been there for so many questions that I've had. I think I mentioned this before, but they have a company called, or an event called Runway for Recovery, and she nominated me to be a model in this year's runway show. So yeah, so I'm actually going to go in a couple days to a town that's actually my happy place. So it's interesting that they're located there, and do an interview, and I have headshots, and they you know, do hair and makeup for the runway show, and I just feel like it'll be a chance to feel like pretty again and like a woman again. I don't know how I'm going to respond to having like all those women there who've gone through what I have, but it's baby steps to get there. So I'm very grateful for her. But I said, I feel like I need to be part of, they told me like there's a group that you can join through the cancer center for people that are breast cancer survivors. They right now I think it's through Zoom, like they talk once a week and they're there for each other. And I'm like, okay, how do I get on that? I feel like I've missed the bus now. There was one in the fall, that one was full. Like there was one for the spring, no one ever said anything. They said they were gonna put me on the list, and now it's like May, spring's pretty much over. So she's gonna look into that and get back to me. But from the breast center perspective, they do peer mentoring, which is cool. They find, like they take your information and they find someone who's like similar in age to you, like similar in, you know, what they've gone through, then, you know, compared to you. And they, you know, they hook the two of you up. And it's just like, you know, it's like having a peer mentor. I feel like it's almost like when you're in AA and you have like, you know, a sponsor or whatever. I feel like that's kind of what it's like. And they're trained, and you have these phone conversations, you know, it's just someone else who's there who can be there to tell you like it's going to be okay, or whatever it is that you need to hear. So waiting back to hear on those. I'm not going to let it slide. I am going to order this tape and see how that goes, and put a note in my phone to follow up about these referrals, to see what happens, and to follow up to find out what the conclusion was after having my oncologist, my gynecologist, and the nurse have their conversation today. So a lot today. Today was a lot. I'm proud of myself with how I handled everything, and I got all my questions answered, and what I didn't get answered this morning, I now have another appointment for tomorrow. So it is so crucial to advocate for yourself. If you think that you're being a bitch about the whole thing, then fine, be a bitch, and then you can apologize later for it. You know, but you have to ask for what you need. And like, you know, I've said it a billion times, like you have one body. When it's saying shit to you, you have to listen. My body wasn't doing anything. Like I could give a crap about the meditating. I didn't like, well, my heel hurt, so walking wasn't ideal. It's like I wasn't finding pleasure in like anything. Not even that kind of pleasure. I'm like okay, whatever. And that's not how I want to be. So like, you know, put the brakes on it and be and reach out and ask for the help. You know, it's easy to crawl back into the shell after things quiet down from all this stuff. And I was there, and I'm like, okay, maybe I'm just becoming an introvert and this is just how I am now, but it's not how I am. You know, I'll never go back to the old me. Never. I'm not that person physically or mentally anymore. But I had to take what I've learned and just, you know, use that to empower myself to be the best me so I'm happy. I just want to be happy. And after today, I feel like, you know, I've spoken up enough for myself that I have a team now who's working on me being happy. Like, they worked on getting the cancer out. They worked on, you know, keeping the cancer at bay. And now it's like, can I please have a life back? Because I don't feel like I have one that's inspiring or empowering me. So, transitions. I'm gonna eat some lunch, and then I don't know what I'm gonna do. I'm not checking it as much, probably why it went so long, because I just don't want to talk about it all the time. I don't. It's time to just like do things for me that make me happy, that are not necessarily about cancer. You know, I can't kayak the way I used to, but can I still kayak? Yes, they make them with pedals. My feet, well, the right one hopefully will feel better and it'll be fine. It's all about modifications. It's not about giving up. What do you have control over? You have control over advocating for you and creating a life that you want, that makes you happy. And, you know, don't ever give up on searching for that. When they do the kindness rocks, their motto is like, you know, one rock and one message at the right time could mean the world of difference to someone. A hug does that too. You know, sometimes words, sometimes it's just a feeling, sometimes it's being in a location that you haven't been in a long time and just taking it all in. Just to realize where you were and where you are now and what you want for yourself going forward, and do whatever you can to make that happen. That's what I shall leave you with. I think I threw out enough gratitude things today and bettered and stuff, so when you hit stop on this, again, think of things that you're proud of yourself for, that you've overcome. And when you think things are so awful, you'd be like, you know what? Yeah, but I got through that. And I got through that. And I got through that. Because you're here. So commend yourself for that. See you soon, everyone. Bye.